Dear friends, thank you once again for the kind invitation and the honor to be among you. I will speak about a relatively controversial topic. This is the string sign, or so-called near occlusion carotid stenosis. There is a good definition for that, so it's very important to, when we speak about vascular entity, to have the right definition. So it's including late internal carotid artery contrast filling, presence of crossover collaterals from the contralateral side, smaller distal diameter of the internal carotid artery compared to the contralateral internal carotid artery, and smaller size of the internal carotid compared to the ipsilateral external carotid. So this is the right definition. The occlusion and near occlusion of internal carotid long time has considered as a contraindication for intervention, and probably useless because it's considered less risky for distal embolization and for stroke cause. But definitely there are data. There are data in the literature that it's not without a risk to have subtotal carotid stenosis, and in patients with proof of perfusion deficit, there is some benefit from the intervention in subtotal carotid stenosis. We have learned from the CAS trial that the patients with critical carotid stenosis have lower cognitive function and lower neurological execution. What are the main mechanisms of critical stenosis? Cognition interaction. So, in fact, it's very important to emphasize that the so-called asymptomatic patients with very fast cognition deficit, in many of these cases, we describe subtotal carotid stenosis. So, it's not exactly asymptomatic. It's probably mimicry of asymptomatic, but in fact, this is symptomatic carotid stenosis. So there are clinical, neuropsychological tests and imaging proofs about cognition disorders, and especially to show executive dysfunction by neuropsychological tests. It's very important to emphasize that brain perfusion benefit after recanalization was proven in several small series, in fact suggesting that probably it's possible to use the carotid artery stenting to improve the flow, not only the flow, but also the neurological execution. In fact, we are examining in our string trial, local trial, examining the possibility for subtotal carotid stenosis revascularization with several very important inclusion criteria. First, cognitive dysfunction proof by neuropsychological test, MRI perfusion, ipsilateral deficit. This is absolutely crucial, and this is the flow chart of our trial. We have included also several laboratory markers test for cognitive brain dysfunction, and we have included 53 patients up to date. Between November 2022 and May 2024, with quite optimistic results, with excellent recanalization rate, but not only carotid recanalization rate, and also TC3 flow recanalization, intracerebral flow recanalization, with extremely low complication rate, one myocardial infarction, and only one TIA, and in fact without hyperperfusion syndrome. It was very interesting to compare non-subocclusion with subocclusion stenosis. In fact, it resulted that the risk for subtotal carotid stenosis intervention is not higher. These are the preliminary results in some laboratory tests showing very interesting results. I'm just showing a case. This is a gentleman with right internal carotid subtotal occlusion with deficit on the perfusion, MRI perfusion, obviously, you see on the right panel. And also very bad dysfunction on the neuropsychological test with cognitive decline. You see this is really subtotal to total carotid occlusion. This is the so-called string sign. So after using a coronary style material, we succeeded, you see the limited crossover filling, so the deficit into the brain perfusion was really impressive. It was absolutely, this is a very late filling of the internal carotid. Using typical coronary CTO Gaia, the second wire, with the support of a very small balloon. Even for the small balloon, it was quite difficult to cross-secune. As you can see here, there is a tension even to cross with a coronary balloon, this subtotal stenosis. And after a small undersized predilation of 1.5 millimeter balloon, we succeeded to put the distal filter. And using radial approach, like is our routine practice, we are using radial approach for practically all the right internal carotid artery interventions. And this is the final result after stenting for the carotid and also for the intracranial restoration of the flow, full restoration, TC3 flow in this case, and with significant improvement, impressive improvement into the perfusion by the MRI investigation. Thank you very much for your attention.